Good morning, good afternoon, and good evening, everyone, and thank you for joining us for the fourth episode of In Conversation With, a webinar series co-convened by the Lancet Commission on Gender and Global Health in partnership with the Gender and Health Hub at the United Nations University International Institute of Global Health. This series continues on from the ongoing work of the Commission, which seeks to bring in a diversity of voices in the Commission's work and ensure that multiple perspectives across all levels are represented. For this episode, we are joined by Commissioner Fran Baum, along with her guests, Connie Mussolino, Jenny Poppe, and Priyanka Sami, to talk about gender activism, politics, and intersectionality in the era of COVID-19. Before we begin, some housekeeping notes. You can follow along and tweet your questions at Gender and Health or Gender and Health Hub on Twitter. We are also live streaming on this platform. We will be live streaming on YouTube as well. And of course, thank you to those joining us on Zoom. There will be a Q&A session, so do keep along with us, engage through the Q&A and comments boxes, and we hope you enjoy. Please do also introduce yourself in the comments and chat boxes. Let us know who you are and where you're joining from so that we can all get to know each other better. Share your thoughts throughout. Feel free to express yourself with emojis. And above all, we hope that you enjoy the session and that you walk away from it with some insights. Today's webinar will begin with a brief introduction and scene setting from our Commissioner Fran Baum, followed by the panel discussion, a Q&A session, and then some closing remarks from a member of our commission. And if we can have the next slide, please. I will now be handing over to our hosting commissioner, Fran Baum. Fran is a professor of health equity at the Stratton Institute in the University of Adelaide with special interest in creating healthy, equitable, and sustainable societies. Fran is joined, of course, by her three speakers, who I'll allow her to introduce because I'm sure she'll be able to do much more justice to their expertise. So Fran, thank you so much for making the time to join us today, and over to you.
Yeah, thanks very much, Tiffany. And I'm glad to welcome everybody who's in our audience tonight, or morning or afternoon, depending on where you are. I'm just going to make a few introductory comments and then I'll introduce our speakers. So if we could have the next slide with that. Yeah, and the next slide till we get to the one. Yeah, so what we've decided to talk about today is having a bit of a look at the background of the impact that COVID-19 has had. We know that it really has highlighted and worsened many inequities that were existing before the pandemic, including those of gender, class, caste, race, disability, and sexuality. And there's massive vaccine inequity, and of course structural violence has been evident throughout the pandemic. It really has structured the response. If we could have the next slide. And in some ways this is shown so clearly by vaccine inequity, and I think the term has become the sort of clarion call of activists around the world. But if we look at Nigeria, where only 13% of people have had any vaccination, and you compare that with high income countries where the figures are in the 80s and 90s, it really is inequities laid bare. And of course, those are just the raw figures. If we then look at the figures for people with disability, people of different sexualities, men and women, then again, the picture will be very different. If we could have the next slide, please. So there have been very many gendered impacts in COVID. We'll be hearing more about these from our three speakers. Women are much more likely to have been on the front line of the COVID crisis. Social distancing and isolation has increased the risk of violence. People have had to work from home and juggle their parenting responsibilities. Children have been missing school, and girls have been more likely to. And it seems that women are more affected by job losses and employment insecurity. And transgender and gender diverse individuals have faced the normal structural or systemic inequities, but the discrimination has perhaps become more pronounced and the economic impacts. So on the next slide, just to highlight that point of the extent to which 2/3 of the people who are not employed, not in school or in vocational training, 2/3 of those are young women. And if we could look at the next slide, the women before the pandemic, women did nearly 3 times as much unpaid care and domestic work as men. And since the pandemic, there have also been the issue of school closures and stretched healthcare systems around the world. And on the next slide, you will be hearing from Jenny Poppe about the Other Frontline Global Alliance that she created to try and look at bringing global voices for social justice into the conversation. And those are voices that are very often ignored. So if we could have the next slide, please. Yeah, so just to introduce our speakers, I have got, first of all, just to say that Anne Kavanagh was meant to join us tonight, but she had a very close family bereavement overnight, so she therefore hasn't been able to join us. She would have spoken much more about disability than we probably will tonight, but I'm sure we can feed Anne's thinking into the Commission's work anyway. And I'm very grateful to Jenny Poppe for having stepped into the breach at very short notice. We were texting each other late last night or in the morning for Jenny, and she's very kindly agreed to join us. We're also, and Jenny is the Distinguished Professor of Sociology and Public Health at the University of Lancaster, and has a global reputation for her work on health inequities and qualitative research. And we're joined by my colleague, Connie Mussolino, who works with me at the Stretton Institute at the University of Adelaide. And Connie does a lot of research on different aspects of civil society and gender and health inequities. So thanks, Connie, for joining us. And then Priyanka Sami is a intersectional feminist and anti-caste activist from India, where she is associated with the National Federation of Dalit Women. And she brings a huge amount of activist experience that we will be hearing about and she will be drawing on tonight. So very welcome, Priyanka. And Priyanka and I are also linked through the global People's Health Movement. So if we could have the next slide, just to show you where we're going tonight. Yeah. So what we'll be doing is unpicking some of the problems that I've already talked about during COVID-19, and looking at that through very much an intersectional lens. And for the first question, I'm going to ask each speaker a question, and they will really be unpicking those problems. And then afterwards, we will do another round of questions, asking them what their solutions are. And we will finish up by asking them to very quickly say what their key messages are for our Lancet Commission of Gender and Global Health as to what we should being included in that. So I'm going to ask Connie first. Connie, Connie and I are doing a study with a number of colleagues around the world. In fact, Jenny is one of those too, looking at the impact of COVID in different countries. So Connie, can you tell us what you've learned about care work in the 17 case study countries that we have considered, and thinking about that intersectional lens?
Thanks, Fran, and hi to everyone. I'd first like to begin by acknowledging that I'm presenting today from the traditional lands of the Kaurna people of the Adelaide Plains in southern Australia, and pay my respects to elders past and present. So in one of the ways that gender inequalities have been most pronounced during the pandemic has been through the care economy. So COVID has both made care work more prominent, stimulating public discussions about how we value and pay care workers and the people we care for, but at the same time has increased the burden on paid care workers and unpaid care workers. So as Fran pointed out, globally, women make up approximately 70% of the global health and social care workforce, even more so in lower paid and informal care roles. The gender divisions of labour and care work were present in all our country case studies, but when we dug a little deeper into care work, there were many intersections of gender, class, caste, race, and other identities. The similarities and differences in the way these factors appear in different countries are often due to their social, cultural, and historical contexts, and to how systems of oppression present in the care economy have unfolded during the pandemic. So I'm just going to briefly touch on 3 examples of to highlight intersectionality in care work in our case studies. So it won't be any surprise to anyone that during the pandemic, it's been reported in all of the country case studies that women have been taking on greater amounts of unpaid care of, in particular, children and other family members. The implications of women having to forego work to take on care impacts their present and future access to more health promoting resources. And this is compounding impacts for women in lower socioeconomic circumstances. And while women have generally suffered greater employment and income loss across all industries, women in health and care industries have also been placed under more pressure to continue working during the pandemic. In the USA, for example, it was noted women on lower incomes and women of colour have made a disproportionate amount of those who have continued working outside of the home in jobs deemed essential, including frontline care roles. At the same time, the same workers are often continuing to contribute more unpaid domestic labour compared to their male counterparts, multiplying the care load and risk of ill health for women in care roles. So a second theme from the analysis is about the impacts of the low paid and precarious nature of care work. So COVID-19 has exposed how the care economy is reliant on low paid and precarious workers. It is shown to put both individual care workers at risk, but has also led to outbreaks of the virus, often in groups who are the most vulnerable. For example, in many of the case study countries such as Australia, the UK and Belgium, where care of the elderly is highly institutionalised, some of the most deadly outbreaks occurred in these workplaces, often spread by workers, and in some cases by workers moving between different locations because of their low-paid positions and needing to hold multiple jobs. Meanwhile, in many middle and low-income countries, the informal nature of this workforce meant workers did not have access to paid sick leave or other entitlements, further increasing the risk of the illness and spread. And lastly, a third theme coming out of the analysis is about the global and historical systems of oppression and how this is related to migrant and undocumented workers in the care economy. So a political economy perspective highlights how the COVID-19 pandemic is intrinsically linked to local and global economic and political histories. The case study countries demonstrate how histories of colonisation, slavery, patriarchy are patterned throughout the care economy, and that these legacies are continued through the exploitation of care workers. Women migrant and undocumented workers from poorer neighbouring countries, both informal and informal roles, make up the largest proportion of the care workforce in many of the case study countries. When COVID-19 interrupted some of the flows of labour between countries and regions, it interrupted the care systems, which often rely on and exploit groups in poorer neighbouring countries. In the case of Peru, it was noted there is a lack of documentation of care work, but that the informal contracting of Venezuelan poor migrants who work as maids or carers within homes meant these workers have not had access to social security or rights during the pandemic and have been more vulnerable to exploitation and abuse. In South Korea and Singapore, while the paying conditions are better, the case studies noted that low-wage migrant workers have had fewer rights and faced harsher public health measures than the majority of other workers, such as mandatory lockdowns. I'll quickly end on a positive example of the government response in Singapore. So a number of measures were quickly put in place when the virus began to spread in facilities, in aged care facilities. The government gave nursing homes funding per worker for relocation to alternative accommodation, provided funding for facility renovations, and provided national long-term funding to support care workers, as well as putting a strategy in place for prevention of future health crisis in care facilities in the future. And I'll end there. Thanks, Fran.
That's great, Connie. That really took us showing these sort of common themes that are there in different countries around the world. And thanks so much for that. That really was pulling out some of those intersectionalities too. I'm now going to ask Jenny if she could say a little bit about why she, with colleagues, has set up the Other Frontline Global Alliance, and really thinking about how gender issues are reflected in the stories that you're uploading to that site. So tell us more about the Other Frontline, Jenny.
Hi, thanks, Fran, and thanks for inviting me. It's a real privilege to be part of this conversation, and I was more than willing to do it at short notice. Quite an ask to replace Anne, but I'll try my best. So the Other Frontline reflects a concern that many of us have had that predates the pandemic, which is that the policy and practice around the globe tends to be dominated by formal science or practitioner and policymakers' perspective, and that the voices of people their stories, their lived experience of social inequalities that drive health inequalities are rarely heard, really. So at the beginning of the pandemic, myself with a group of people were wondering how on earth we could do something practical in this situation. So the Other Frontline Global Alliance was set up to provide a platform, an online platform for these groups bearing the brunt of social injustice to be able to tell their stories, and then to work with them and other people to try and get those stories and the storytellers into conversations about the impact of the pandemic exacerbating inequalities and what potential solutions were. So we know actually that knowledge inequality continued during the pandemic. So, you know, governments and international agencies listened to the science. The interpretation of the science was certainly somewhat variable, you know, with Trump's digesting bleach being a classic example. But nevertheless, you know, there was a lot of attention to epidemiology, to virology, to public health science, to behavioral science, much less attention to qualitative social science, and virtually no attention, certainly in the countries I'm aware of, to narratives, to lived experience narratives that are not generated through research. So that knowledge inequality has continued. I think there have been some other examples like the Other Frontline where people like the People's Health Movement have tried to bring lived experience into the fold, but it is a struggle. It is a struggle. And what I think the stories on the Other Frontline website show is just what we're missing evidentially by not involving people with lived experience and not listening to and acting on their stories. So, I mean, Maya Angelou is one of my heroines, and she's obsessed. I was obsessed with the power of stories. You know, stories and the meanings embedded in all our stories help us to understand the nature of social problems and begin to think about appropriate solutions. I mean, she made this amazing comment when she got her Nobel Peace Prize about having an untold story, the agony of having an untold story inside us. And she wasn't only speaking as an author, she was speaking as a human being. And I think some of the stories on the Other Frontline web platform, and there are platforms, for example, I only know the ones in Europe and a couple of international ones, but there are platforms where people with intellectual disabilities have been telling their stories of their experience during the pandemic. There's a global platform for people who survive through fisheries, small fisheries industries, many of which are women, telling their stories of the impact. And the People's Health Movement have their case studies from many different countries. So there have been lots of attempts. And if you read those stories, they support everything that Connie was saying. So I would say 2/3 of we call them journalists, the Other Frontline journalists. They're from groups, Roma women, people living in low-income neighborhoods. They're in Spain, Wales, Scotland, England, Brazil, the US. We've got a lot of reach to do, but they're quite diverse. And they absolutely reinforce the strengthening, deepening of gender inequalities. So many of these women talk about the intensification of their roles as carers, informal carers, paid carers, teachers, mothers, community activists, all in the same woman. These are single women talking about the deepening of these roles that they have, the traditional roles that they have. They also talk about how their living conditions made it so unsafe. It wasn't their working conditions, as Connie absolutely says, but their living conditions in Eastern Europe with no running water. You know, their housing in one of the richest countries in the world, here in England, where people were living in apartments on the 17th floor of blocks with 1 bedroom and 3 children, no balcony, no access to green space. So there are powerful stories about how women in particular had to manage these unsafe living conditions as well as the unsafe working conditions. But interestingly, Fran, there are also amazing stories about what equity might look like in mostly high-income countries. So, for example, there's a really powerful story from a woman who is living in a neighborhood in Italy, which is surrounded by a major highway, a railway line, and then on the third side of this triangle, there's the airport, right? And all the transport stopped, of course, particularly during the first year. And these women talk about the peace that descended in their lives, that there was no noise, the air pollution reduced, their children's respiratory problems improved, and they heard birds for the first time for years. They were listening to bird song. So they were, in the most difficult of circumstances, they're describing what it would be like if their lives were less unequal, really. And there's a lot of those kinds of stories. There are stories about the deepening social relationships in communities, in families, improved relationships between mothers and daughters, for example, alongside, and that's not to negate any of the negative stuff. You know, these different perspectives coexist. Of course, they coexist in our lives. And one of the things about these lived experience stories that I think Sam Keane, I think it is, that said is that telling your story is a revolutionary act, right? So we've got these revolutionary acts on the website where people are resisting the stigma that is unintended in the way we tell the story about inequalities and the pandemic. But there is a real risk that we deepen that and that we don't recognize it. I don't like the word resilience, but I do recognize strength and resistance. And that's what some of these stories are saying. They're saying the pandemic has deepened inequalities. It's deepened gender inequalities. But, you know, we're resisting that. We're resisting both the symbolic side of it, the way we are labeled, but also trying to resist certainly the social impact and to some extent the economic impact by relationships of reciprocity at a local level. So just to reinforce that, I'm not saying that these are good things, but I'm saying we have to kind of recognize that this duality in people's experience, and what that's a message for policy, I think. Not to, in the UK, what we have as a response to some of the arguments about resilience in communities during the pandemic is what I refer to as do-it-yourself welfare. Well, then we'll let communities do it because they've done it so well during the pandemic. I don't think that's the implication of these lived experience accounts. I think it's about the importance for equal partnerships between the public sector and lay communities in delivering a recovery that is much fairer and much more equal.
Shows the way in which those kind of stories can overcome the sort of victim blaming that can happen with people who are living in disadvantaged situations and whose lives are really challenging, but showing how much dignity they basically have within those lives. So thank you. That leads us nicely really to Priyanka's question. And as I've said, she's a really great activist and anti-caste activist, and I'm sure she'll draw on that experience. But for you, Priyanka, how has gender, together with other elements of intersectionality, played out for you in terms of civil society in the Indian political sphere through the pandemic?
Thanks, Fran, and hello, everyone. I'm really delighted to be here. Thank you for inviting me. So in the case of India, you know, it's really important for me to center stage the caste system. You know, India's caste system is the longest surviving social hierarchy, with the Brahmins at the top and the scheduled castes, also known as the Dalits, and tribals at the bottom of that pyramid. So the caste system sort of sanctions discrimination and exclusion from socio-cultural, economic, and political life. And Interestingly, caste is not confined just to social institutions, but it also sort of influences the political economy and policy making in India. So, therefore, the social location of the Dalits and tribal women being at the lowest rung of the caste and gender hierarchies results in them facing multiple forms of marginalization and targeted violence both by the state and non-state actors. And I think during the pandemic years, this really sort of played out in every sphere. So in India, the pandemic, like most of the developing countries, exacerbated in existing inequalities and really exposed the fragility of our governance systems. On March 24th, 2020, the government of India announced a countrywide lockdown to check the spread of the virus. And this lockdown was, we weren't given a notice, it was an immediate lockdown that the government had imposed. And the government sort of imposed this lockdown, assuming that everyone has food and shelter in a country with 1.8 million homeless people. And this sort of led to a tsunami of suffering. And depending on where you were on the social ladder, you bore the brunt of it. And in terms of stringency of government responses to the pandemic, I think India ranks the top. So, even the World Bank, I think by December 2020, had estimated that the pandemic in about 4 or 5 months had already impacted about 40 million internal migrants. And the ILO cautioned that 400 million were at the risk of falling deeper into poverty. And of course, all of you would have seen on the news that there was a huge migrant crisis with 90% of migrants who belong to the Dalit and Adivasi communities lost Adivasi, as in the indigenous communities. They lost their livelihoods and shelter overnight, and they really sort of walked back from India's metros and cities to their villages. So, due to the government's unplanned lockdown, there was no assurance of food, money, or transport, and thousands of families, women, children, babies, sort of walked back, and it sort of unfolded into one of the biggest human tragedies, with several people dying of starvation en route. So, and also, for instance, the government's announcement did not check the accessibility criteria. So, persons with disability, especially the blind and the deaf, had no access to equitable COVID related guidelines, for instance, and the government announcement with regard to relief packages. So it was like everything the government was doing was further marginalizing the marginalized. And, the government policies during the COVID years favor the crony capitalists, of course, and income inequality was at its peak during these two COVID years. The top 1% held about 4 times more wealth than the lowest 70%. And when we talk about women specifically, data reveals that women in extreme poverty in India was 73 million in 2019, and it increased to 110 million in the year 2020. So I think it's important to note that in India, 94% of women who are counted as being a part of the workforce remain in the unorganized and informal sector. Most of them are domestic workers, workers in garment factories, agricultural laborers, contractual laborers. And when you sort of do a social profile of these workers, most of them belong to marginalized communities, especially from the Dalit and the indigenous community. So over 80% of domestic workers immediately lost their jobs when the lockdown was announced. And on the whole, 79% of women lost their jobs in the country. 79% includes the salaried and the non-salaried, the formal and informal. And of course, data shows that there was a higher vulnerability of women's jobs because the pandemic resulted in unpaid care work and domestic work burdens. And this was particularly dramatic for marginalized communities, for women with disabilities, trans women, etc., which of course affected the labor market participation substantially. And, talking about the shadow pandemic, the norm was really social distancing. But when you look at the incidence of violence and sexual harassments against Dalit and indigenous women, it has been the highest ever. And in fact, in the last decade, we haven't seen such huge numbers. So all women, and especially women from Dalit and indigenous communities, were sort of further distanced, discriminated, distressed, with no access to essential services and rights whatsoever. And when we talk about women frontline workers, in India, our women frontline workers are called ASHA workers, and then we have the Anganwadi workers and the auxiliary nurse midwives, and they were severely overworked and underpaid during the pandemic. Delays in wages, lowered compensation, and very little recognition for the loss of lives due to the virus. Really left them without any recourse, and these workers were sort of pushed into debt burden during the pandemic due to the due to the inadequate wages and delays in payments from the government. And most of these workers were also deprived of the COVID-19 relief packages distributed by the government during that time. So, in India, the COVID-19 crisis, in a sense, really center staged and highlighted the fact that there has been a long-term policy neglect on women as a whole, and especially on marginalized women. The lockdown really resulted in a colossal and, I think, preventable humanitarian crisis, and that's what is so terrible about it, that the government policy completely lacked a social justice lens. And in every policy and in every response that was announced during the pandemic. So yes.
Thank you so much, Priyanka. I think what you've described is like a perfect storm of factors during COVID that affected women, and intersections between class, gender, caste, disability, sexuality. So thank you very much for that. We're now going to try and move on to think a little bit about, well, where we've outlined some pretty awful problems that emerged from the pandemic, and in thinking about solutions, I'm going to turn to Connie first and ask you, Connie, in the case study countries, the 17 case study countries that you're currently studying, what examples of good practice in terms of civil society activism did you see, or indeed maybe bad practices, whatever? So.
Thanks, Fran. And I think we've touched on some of these things already a bit, but despite the global crackdown on civil society recently, which has been noticed, one of the crucial roles activists have played is around, as we've discussed, highlighting inequities caused by the pandemic and by government responses. So while civil society has played a huge role in providing health and social services and filling gaps, thinking in terms of the themes of this panel around activism and politics, there were numerous ways that civil society has played a role in the politics of COVID-19, not just in political decision-making, but also in public discourse. So this has often meant engaging in political debates about health information and public health mandates and building public awareness. So some of the examples from our case studies were activist groups playing a role in fact-checking of misinformation, in translating health information for migrant, refugee, and undocumented communities, organising events to share information, and playing a role in amplifying the voices of people and groups in marginalised positions. Another key role has been in combating fear and stigma. So there have been many instances where groups already in a stigmatised position due to their gender or race or other identity became scapegoats by governments and the media. Civil society in these case studies have been pushing back against the politicisation of such identities during the pandemic. So for example, in South Korea, when there was an outbreak of COVID-19 at a nightclub for the queer community, some media began to spread misinformation and fuel discrimination and stigma against sexual minorities. In response, civil society groups created the Civil Society Emergency Headquarter for Sexual Minorities during COVID-19, which brought together 23 organisations. So this coalition raised the concerns of outing of sexual minorities in the process of tracing COVID-19 and proposed the Metropolitan Government introduce an anonymous testing policy, which was accepted by the government and effective for managing the cluster of the virus infection. So this coalition then also led to a COVID-19 human rights response network and social guidelines for human dignity and equality in South Korea. So that's quite a good example. But on the other hand, there's also been examples of civil society activism, which you could say has been more against public health measures, for example, anti-vaccination movements. And I think in thinking about the politics of COVID, these groups have engaged in the political discourse, lobbied government and industry bodies to influence such things as withdrawal of mask mandates. So in Nigeria, the US and Brazil in particular in our case studies, but also noted really in most countries, anti-vaccination movements were manipulated by governments for political gain. So for example, in Nigeria, it was noted that the federal government allowed mass anti-vax political rallies without social distancing in the lead up to the 2020 election. However, shortly after, demonstrators had been arrested for gathering in public to demand better pandemic responses. So likewise in Brazil, President Bolsonaro, while largely having a history of anti-democratic stances and cracking down on civil society, supported big street events and demonstrations and public campaigns which were anti-vaccination and anti-public health measures. So lastly, again, trying to come to an end with one positive, an international example of civil society activism has been, and bringing, I suppose, into how Fran started actually, has been on access to vaccinations, which is fueling global health inequalities. So in our case studies, South African and Indian civil society organisations have played a leadership role in advocacy and awareness raising domestically and internationally in forums to support the TRIPS waiver proposal initially tabled in South Africa and tabled by South Africa and India at the World Trade Organization meeting in 2020 to address these inequities, which of course speaks to civil society engaging in broader issues around politics and power, which again kind of highlights the intersections of repression during COVID-19, but at that more global scale. So I'll just end there. Thanks. You're on mute, Fran.
Sorry, I was on mute. I was just thanking Connie for bringing us those examples of civil society and saying how helpful they are in understanding the power of civil society for good or not. Priyanka, what about in India? You know, can you give us some hope about making gender matter in political discourse in India?
Yeah. Am I audible, Fran?
Yeah, we can hear you, Priyanka.
Okay. Yes, thank you. So I'm going to highlight the work that we did in the National Federation of Dalit Women during the pandemic. In the pandemic years, the academic institutions, like across the globe, shifted to digital modes of learning, virtual lectures, online assignments, webinars, etc. However, in the absence of equitable access to digital infrastructure, including internet services, laptops, smartphones, students from marginalized communities, especially girls from marginalized communities, face extraordinary challenges. The future prospects of marginalized girl students was sort of disproportionately affected, jeopardizing their chances of their path out of poverty and marginalization. So, in the villages and communities that we work in, several Dalit and tribal and Muslim students dropped out of college and were sort of forced to work as day daily wage laborers in the informal sector. And, it was absolutely heartbreaking and also very demoralizing and disempowering for these students who were sort of pursuing their PhDs and postgraduate courses to drop out and take up menial and scavenging jobs to feed their families. So, therefore, we decided to work with girls from marginalized communities. And, these girls were first generation learners with no financial resources or social capital whatsoever. So, we sort of heavily invested in strengthening their collective agency and leadership skills, particularly of girl students. So, we sort of organized them in ways, of 6 girls per constituencies, and they sort of interviewed migrants and created a database for their immediate needs, including testing for COVID-19. And the girls in their respective communities led a delegation of 6 volunteers and advocated with the head of the village council or the subdivisional magistrate and the doctors in the primary health centers to provide immediate relief to these migrants. And they were really persistent, and they were all sort of first time coming out of their homes and working in the field. And they were really persistent in their advocacy efforts, and followed several times with the government authorities. And as a result of this, there were health camps organized in their communities, and they also sort of advocated that dry rations be distributed and shelter provided for these migrants in government centers and government schools. So once they saw it as an advocacy win, and I think it was commendable, their effort. And they were really at it for months together. And once they sort of succeeded in this endeavor, they quickly moved on to sort of doing a door-to-door survey, to sort of assess the number of families, especially below poverty line, without the necessary documentation to receive government COVID-19 relief measures. And they very swiftly sort of work towards giving those people and families access to the required documentations, and sort of really lobbied with the local authorities to facilitate access to entitlements. And also during this time, while they were sort of doing work on the ground, they were also facing several challenges in pursuing their education online. So, we sort of, all of us collectively met with social welfare officers in charge of education for marginalized communities. We sort of demanded that the government provide basic digital infrastructure for marginalized girl students. And, in some constituencies, the government was sort of receptive. They did make a few arrangements in the communities for free internet, Wi-Fi, and smartphones. And I think they saw this as a great advocacy win. And something that we realized was, while the aim was to sort of build a collective agency of marginalized students, I think it did a lot more for them in terms of personal empowerment as well. I remember one of the interviews we had held with a girl student called Angelou. She said, people here are not used to young women raising their voices and engaging with the government to sort of influence development outcomes. However, during this time, and because of our efforts during the pandemic, people in our own urban slum, who were earlier dismissive of our very being, now sort of respect and look up to us as leaders. And for me, this example really reflected the gradual shift in power equations and socially accepted norms. Here we're talking about a context which is very patriarchal and very casteist, and we could see slight shifts in regarding girls' agency, education, and leadership. And I've thought that the emerging social capital of women student leaders really had the potential to change status quo, but of course, it needed to be nurtured and leveraged to encourage greater democratic participation, sort of paving the way for inclusive and responsive governance at the grassroots. So, just to sort of sum this thing, I think there has been a complete depoliticization, especially with the current dispensation. There's been a huge crackdown by the Modi government on civil society, and especially groups working on human rights and working for the rights of the marginalized. And we during this 2 year period, we saw incarceration of student leaders, of human rights defenders. And so every little step that we do, I think, is important. And a great learning from this, from advocacy and engaging at the grassroots during the pandemic years for me, was that inequality is political, and therefore our effort to sort of overcome this inequity and inequality also has to be political. It There is no other way to it. And during this time we also worked with other groups such as manual scavengers. Although manual scavenging has sort of been banned in India for over 2 decades, the practice sort of continues unabated. And manual scavengers are really the Dalits among the Dalits. They're the most marginalized community in India. And the idea in India, the idea of waste, which is impure, which doesn't qualify dignity, is supposed to be in the custody of the Dalits. So during the pandemic, we saw Dalits were segregating toxic waste, use masks, gloves, body waste, even at the hospitals and homes.
Yeah.
And we advocated, sorry.
Yeah, that's great, Priyanka. I think because we're getting short on time now, but thank you so much. That really showed how a marginalized group was able to organize and challenge political power and be able to take that forward. And Jenny, a final question coming to you is, what contribution do you think the model like the Other Front Line and the stories that you are collecting on your website, how can they reduce inequalities during and after the pandemic? How do you see them influencing policy, I guess?
Well, quickly, I'd make 3 points. First is, I think that without activists enabling this possibility of stories being gathered and storytellers being supported to tell their stories, they're not going to have a lot of impact. It's inevitably the case, I think, that kind, in a world that is so obsessed with science, that narrative stories are not given a lot of value. So we have to work out ways to increase that value through whatever avenues we can, really. And although civil society globally uses stories a lot, and they can use it to significantly impact, I think the fact that civil society has also got a relatively low status in the world of policy and action means that that's not enough either. We need academics to take it more seriously. The academics will usually blame the policymakers for not listening, and that's not true. Many academics in the social policy and public health world don't take stories seriously either. They still have a kind of prejudice against them as simply anecdotal. So I think that's important, is thinking about strategies. And I think these global platforms like Other Frontline are one way of doing it, though, as Priyanka has said, the digital inequalities make it more difficult to use the digital space, but it's a really potentially a very powerful space. So democratization of that space would be really important. I think there are 2 other points that I would make. One is that, that keen point, Maya Angelou's point about the agony of untold stories. I think that giving people the opportunity to tell their stories, just to tell their stories, is generally reported to be a very positive experience. just the telling of the story is a positive experience. And most of the stories on the Other Frontline platform are collective stories that we have very few of our journalists who are working on their own. They're in groups. And they may be individual stories that they tell, but the stories are being created collectively. So the process of storytelling itself is, as Keane says, a revolutionary act. And it's an empowering act for people, even if they're not listened to by people outside their immediate networks. So I think that just providing more and more opportunities for people to tell their own stories and to do that in a collective way is part of the revolution we need, really. And then part of that is what the Other Frontline is trying to do, and it's really difficult because of the language issues, is bring people in different countries, in different places and spaces together, and to forge a common interest that they may be, Roma women in Eastern Europe may have profoundly different experience of stigma and discrimination and disadvantage than low income, white, working class populations in Wales, but they also have common interests. And I think that there's certainly one of the things that People's Health Movement has done very successfully around universal healthcare is bring groups together from very different living and working conditions to recognize their common interests. So I think doing that more broadly around social injustice in as many ways as we can is going to be part of the solution. And then I suppose my final point would be one of the things that some of the stories that we've been gathering and some of the storytellers, I mean, I just think Priyanka's comments they're so profound, really. That impact on the scale in India is obviously not replicated in many places, but it is replicated in a micro all over the world. And one of the Bulgarian Roma women in one of her stories called it a merciless pandemic for people who were already bearing the brunt of social justice. And I think that account of what has happened and continues to happen in India is such a powerful illustration of the merciless pandemic that we're still experiencing. But in recent conversations, I'm aware that people are beginning to talk about learning from equity-sensitive policies. And there are two examples of that in high-income settings, notwithstanding, Fran, what you said about vaccine inequalities globally, is that in many high-income countries, one of the equity-sensitive policies, inverted commas, that people are talking about is the rollout of the vaccine to more marginalized groups. And Spain was very successful, for example, in doing that. But also even in England, which has been, not very well, equity absence really, but, and the other example that people talk about is the approach to finding shelter for homeless people. I mean, in places like London and Manchester, they virtually eradicated homelessness during the first 6 to 8 months. So, and these are now being touted as equity-sensitive policies and what we can learn from them. And I just have a gut feeling that the primary driver of these policies was not equity, right? There clearly were people involved who were very, very concerned because of the equity. But the reason they got implemented nationally, I think, was because of protecting the population and particularly protecting the more advantaged sections of the population by ensuring that least advantaged people were vaccinated and that we got people off the streets and that the homeless were not a route for spreading this virus into other parts of the population. So, and I think some of the stories that we've got reveal some of that really. So for me, these were not equity senses. They were not driven by equity. So maybe we need to understand what did drive them. What were the narratives that got governments, well, certainly like the Westminster government, to implement policies that were equity sensitive for other than equity reasons, and what we might learn from that could be useful. And certainly, as I say, some of the stories we've got reveal some of that. That actually the way, for example, some of the income support initiatives were driven out were employer sensitive, but not employee sensitive.
Yeah. Jenny, we got a question that you might like. We haven't got much time for questions, but Megan Warren's asked whether collective practice of care and activisms can demonstrate change in that it can challenge the dominance of neoliberal concepts of self-care and individual responsibility. Do you see that could happen, Jenny? I know that's very much...
I do, absolutely. I think that is right. But I think we need to be savvy. We need to realize the risk, because as I say, in many European high-income countries, because of this narrative about community care and the powerful reciprocity, that was clearly evidenced through food banks and social relationship stuff. It happened, absolutely did happen, and it happened in some of the most disadvantaged neighborhoods in England anyway. But because of that, the risk is that actually communities get given too much responsibility because of these models, and the models are not appropriately supported by either material resources, financial resources, but also by a collective public sector. So we localize welfare, and we communitize welfare, in a way that I think could be very problematic, because there's certainly a bit of research that suggests that communities that are the most disadvantaged are kind of DIY welfare, really. So yes, the models are interesting models, but because many of the models I'm aware of in the UK had little public involvement, because the public sector was so busy doing other things, it wasn't a deliberate thing by local government. But because they weren't there, I think that the risk is that the next iteration of the welfare state post-pandemic in countries that did have good welfare provision will be this DIY model. There's a movement in England now calling it the community paradigm, which sends shivers up my back, actually.
Well, look, thank you. We've run out of time. So I had asked you all to think about recommendations for the Commission, but maybe you could email some of those dot points in. And I want to acknowledge that Matt Fisher has asked about examples of environmental issues that have entered into the gendered impact of COVID, and also Peter Baker, who points out that men had significantly higher rates of serious illness and mortality, and that's a really important issue, and we unfortunately not going to have time to cover it tonight. So I'd really like to thank the three panelists. You've raised so many crucial issues, I think, about this intersections between COVID and all these other factors, and just fantastic for you willing to sort of come along and speak about your passion, your activism, and the research that you're doing. And I think all we need to do now is to tell you about the next seminar. I think we've got another slide coming up, which is going to be in conversation with change makers. And it will be a thought-provoking discussion on youth-led feminist activism at the grassroots level. So that's really going to follow on nicely, particularly from Priyanka's work. And the partners will be the Activist Education and Development Centre, the Reverend M.S. Lagongolo Foundation, and the Young Women's Leadership Initiative and Zamara Foundation. Please follow us on Twitter on Twitter for the Lancet Commission, and you can see all the hashtags, etc., that you need to use. And we look forward to seeing you on the 14th of July, and that one will be 2 hours earlier than this webinar, starting at 8 a.m. UTC. So thank you very much, everybody, and good night. And I hope you've enjoyed our discussion. Goodbye.